good afternoon, everyone who's joining us in the room and online. I'm Veronica Lernervez. I'm the Head of Impact and Engagement Australia at the George Institute for Global Health. Over the last 12 months or so, the George Institute has been working with the McCabe Centre for Law and Cancer and other partners to raise awareness of the 4th UN high-level meeting on non-communicable diseases and mental health. As a platform for stronger action in Australia, the Indo-Pacific region and globally to prevent and control NCDs and promote mental health so that people everywhere can live a long and healthy life free of chronic disease. Thank you for joining us today for the View from New York to digest the outcomes of the 4th high-level meeting with people who were there and to have a discussion about how we can continue to make progress on this critical health priority. Before I introduce our speakers, I want to acknowledge the traditional owners of the lands on which we're joining you from, the Bidjigal people of the Eora Nation here in Sydney. We recognise their ongoing connection to land, sea, sky and community and pay our respects to elders past, present and emerging. We extend our respect and acknowledgement to the elders of lands that others are joining from today, including participants from our broader region and around the world. We have a fantastic group of speakers for you today who'll share their reflections on the progress made and how we can collaborate and continue to build momentum towards stronger action to address NCDs and mental health. We've also set up a QR code where we'd like to ask you some survey questions to better inform our advocacy and engagement in the future. And Rinka will share that in a moment. If you can use that QR code, we'll come back to you at the end with some feedback from you. We've had a really fantastic response to this event and we're expecting lots of people to join. So we're aiming to have some time at the end for questions, but I encourage everyone to share your questions and comments in the Q&A function and the chat, and we'll follow these up offline if we don't get to them during the session. So now I'd like to introduce Professor Anushka Patel, who's CEO and Director of the George Institute. Anushka is a cardiologist and researcher and Scientia Professor of Medicine at the University of New South Wales. She's also attended 3 of the 4 high-level meetings on NCDs, so she's going to share her reflections on the outcomes of the meeting just past and where we should focus our efforts now. So over to you, Anushka.
Thanks very much, Veronica, and thanks for the opportunity to just share a few reflections of this last meeting. It was definitely an interesting experience attending the fringes of the high-level meeting in an environment which you can almost describe as febrile from a geopolitical perspective. And the only mention about health in the mainstream media during the week was this, of course, this amazing discovery of the links between paracetamol and autism. It was an interesting week. I didn't actually attend the high-level meeting, given that the political declaration had already been finalised, and I'm not going to touch on the content of that declaration. I'm sure others will. But for those who are interested, there's a very good summary and response by the NCD Alliance, which is available on their website. I did attend a number of side meetings, and while you do tend to quite quickly start seeing the same faces and quite similar messages at some of these meetings, it was undoubtedly a great opportunity to reinforce alliances and to share both successes and common challenges that all of us are facing. A highlight for me personally, because there's so many people in New York at the same time, was to be able to engage in a number of one-on-one meetings. And really these were the opportunities for action, which is really the theme of today's webinar. As Veronica has mentioned, I've been to 3 prior high-level meetings on NCDs. I attended side events around 2 of these. The first one was in 2011 and the last one in 2018. And what I'd like to do is just share some reflections of what I perceived as notable shifts during this period. I would hasten to add, there's no evidence based on what I'm going to say. It's just my perceptions. The first is that despite an obvious dilution around the role of civil society in the actual political declaration, I sensed a deeper and more extensive involvement of civil society, not just organizations representing a broader range of specific NCDs, but also groups that have previously really focused on other conditions, particularly infectious diseases and maternal and child health, extending their interest to NCDs. Second, leadership from low and middle income countries was more obvious, with many examples of actual action and innovation going beyond the rhetoric. So, for example, I moderated a panel on the importance of data and evidence to inform multi-sectoral action on NCDs. And there was a great example from Brazil of using health and fiscal data to drive tax reforms. The Minister of Indonesia seems to be everywhere during the week, speaking about some important initiatives in that country around cardiovascular disease and cancer. Conversely, though, I felt I heard less from higher income countries around practical examples of action, and wondered whether the continuing challenges of inequities, both driving and being driven by NCDs in countries such as Australia, risk being under-recognized. Third, there appeared to be an absence of substantive focus on the intersection between sex and gender and NCDs. In 2011, and then reaffirmed in subsequent political declarations, governments committed to taking a gender-based approach to NCD prevention and management. And this is somewhat watered down in the 2025 declaration. And not too many events that I attended, at least, reinforced practical action. There were some women-specific NCD events. And finally, at face value, at least, there appeared to be more involvement of people with lived experience in panels and discussions that I attended. Now, the extent to which this was truly meaningful, I can't and shouldn't comment on, but I look forward to hearing from some of the other panelists on this. But I didn't actually hear much about community involvement, engagement, and indeed leadership when it comes to action on NCDs. From a George Institute perspective, and we're a research organization that has a particular focus on going beyond the research to impact, despite many obvious barriers to progress, there were opportunities. And I'd like to finish very quickly with 4 examples in the areas of shift that I've alluded to. First, we're engaging in a range of new, exciting, non-traditional partnerships to facilitate real impact. And these include organizations that have very successfully, for example, facilitated affordable public access to essential medicines on infectious diseases globally, and they're now moving to NCDs. Second, we'll continue to contribute to accelerate actionable evidence and advocate with policymakers across the economic spectrum of countries where we work. And here in Australia, for example, despite the exclusion of NCDs in the initial remit of the new CDC, we'll highlight the opportunity for Australia to participate in the hypertension control targets outlined in the political declaration, given so many Australians are inadequately managed. Third, we'll continue to produce data that helps to hold governments to account, such as recent analyses that the George Institute researchers in India have conducted, showing that only a small minority of country NCD plans are currently gender responsive, despite years of commitments. And finally, we'll double down on our own commitment to embed meaningful consumer and community engagement and involvement in our work. Now, Veronica's on the screen, so that's for me to hurry up and finish now. But I really look forward to hearing from the rest of the speakers in the panel on going beyond the declaration to action. Thank you.
Thanks so much, Anushka. I think really interesting reflections and just highlighting the importance of continuing to focus on action as well, and the need to translate this declaration into meaningful action. So I'm going to introduce Hayley Jones, who is the director of the McCabe Centre for Law and Cancer, to give us a little bit more of a deep dive into what the declaration actually says and what it means for us. Welcome, Hayley.
Thank you so much, Veronica. Can I just check that my slides are sharing correctly?
Yes, they are.
Great. Okay. Thank you so much, and it's wonderful to see so many people joining us today. It was a real honour for me to represent the McCabe Centre and Cancer Council Victoria at the UN High-Level Meeting on NCDs and mental health, and to have worked closely with the George Institute, UICC, NCD Alliance and World Cancer Research Fund in the lead up to the high-level meeting to try to influence the political declaration to ensure that we came away with something that was going to be meaningful. So today I'm just going to take you through a few of the commitments in the political declaration, and we'll have some further discussion through our panelists as well, focusing on some of the particular areas. So as has been mentioned, there was a really high approval for action on NCDs and the political declaration, with governments from every region reaffirming their commitments to tackling NCDs. And there were some really notable achievements within the political declaration that we should be proud of, including strong language around access to affordable medicines, integration of mental health, reference to Indigenous people, and financial protections. So the political declaration calls for action on cervical, breast, liver and childhood cancers, calls for at least 80% of countries to implement strong policies, including legislative, regulatory and fiscal measures on NCDs and mental health, and calls for at least 80% of primary healthcare facilities in all countries to have availability of WHO recommended essential medicines and basic technologies for NCDs and mental health conditions at affordable prices by 2030. And it reinforces commitments to equity and global solidarity. Okay. And for the first time, member states included specific targets, fast-track global targets and 5 tracer targets within the political declaration, which are important benchmarks on the way to achieving the 2030 targets. So these are seen as a critical win, given the 3 previous political declarations stopped short of including such specific measures. And the targets for 2030 included 150 million fewer tobacco users, 150 million more people with controlled hypertension, and 150 million more people with access to mental health services. Unfortunately, some of the stronger commitments on prevention were not included or were diluted in the final political declaration, and we know that industry was very active in trying to influence the final language. A draft proposal included that at least 80% of countries introduce excise taxes on tobacco, alcohol and sugar-sweetened beverages. So that was removed in the final version, and instead governments are only encouraged to consider such measures. In terms of Australia specifically, Australia, Canada and New Zealand had worked as a bloc on negotiating language within the political declaration in the lead up, and also presented a shared statement during the high-level meeting. And this included noting its commitment to addressing the global challenge of NCDs and promoting positive mental health and wellbeing, noting that NCDs disproportionately impact developing countries, including small island developing states, and that places significant pressure on already stretched health budgets, and noted the importance of action on NCDs in addressing health inequities for Indigenous people. And Australia separately also emphasised its commitment to working with other countries in our region to address NCDs, and noted an increased investment in work with our Pacific Island Forum partners, including on NCDs. So in closing the meeting, the President of the General Assembly recognised the broad support for the text, and the declaration has now been referred to the UN General Assembly, and it will move forward through the formal UNGA process for adoption as a resolution in the coming weeks, and it's expected to pass there. A further high-level meeting on NCDs is set for 2031, and before then there will be other UN high-level meetings with a health focus, probably most notably the UN high-level meeting on universal health coverage scheduled for 2027. So what does this political declaration give us? It does present some critical opportunities for cancer control, which is our area of focus, as well as NCD advocacy and action. And while the final outcome represents largely continuity rather than a lot of ambition, it does provide a framework for governments that can be built on. And the challenge is ensuring that member states move beyond these commitments on paper to implementing concrete measures to strengthen prevention, expand access, and protect people living with NCDs from financial hardship. And a comment that we heard consistently throughout the week was that we can see this political declaration as the floor and not the ceiling. The inclusion of global and tracer targets provides a foundation, but countries must keep raising their ambition to drive measurable progress, equity, and accountability. We have a lot of existing frameworks, evidence-based measures such as the WHO Best Buys, the WHO Framework Convention on Tobacco Control, and global action plans to help guide specific activities which can be implemented for action. And a key for us will be driving multi-sectoral coordination, given that so many activities required to progress action on NCDs do sit outside the health sector. We know that by 2050, the number of people living with NCDs will double across the globe. And so we need to fight for prevention and the rights of those affected, because these people will be our friends, our family, our colleagues, even ourselves. So now we need to put the commitments from the UN high-level meeting into action, and we can use law as an anchor for many of these. Law can be a powerful tool to transform this political will into real enforceable action. So that's enough from me for now. I'll pass back to Veronica and looking forward to hearing the discussion.
Thanks so much, Hayley. And yeah, I think that was a really fantastic summary of the political declaration, which is really the basis for consensus and action moving forward. I'm going to introduce our panel now. So to start with, we have Lozolini Batiwale, who is the UNICEF Youth Representative from Fiji. We have Dr. Kate Armstrong, President of CLAN, Caring and Living as Neighbours, which is an organisation focusing on quality of life for children and families living with chronic health conditions. We have Dr. Abdul Malik, a founder of the Maldives NCD Alliance and former senior official in public health within the Maldives government. Professor Karen Canfill, Professor of Public Health and inaugural Director of the Daffodil Centre and co-leader of the Elimination Partnership for Cervical Cancer in the Indo-Pacific, and Vicky Durston, a leading advocate for breast cancer policy reform and Director of Policy Advocacy and Support Services at Breast Cancer Network Australia. So welcome everyone. I'd like to come to you first, Lozolini. I think Kate mentioned earlier when I was speaking to her that there's been some movement here on young people. So as a youth representative, you've been active in representing Fiji on a global platform through the Fix My Food campaign. Can you reflect on your experiences in New York and just give us a sense of how young people and Pacific Island representatives were able to participate in the deliberations there?
Thank you, Veronica. So sorry, I have a few issues with my camera. So
that's all right. We can hear you. So yeah, thanks so much for being able to join, even with a few technical difficulties.
Hi everyone, I'm Lozolini Batiwale. I'm from Fiji. I represented Fiji as a UNICEF youth advocate, and I had gone to New York to be part of the Youth Mobilization Lab. Not only was I part of that Youth Mobilization Lab, I also attended a few other events on the side that were done before the actual day of declaration. So through those events, I was able to be representing the youth. And I wasn't only representing Fiji, I also wanted to represent the Pacific region as well. So I was able to, I felt the deep responsibility to share my lived experiences with people of high status as a first-timer. And through the fact that I was able to attend those events, I was very much grateful to be there because I was able to share my views as well as highlight the issues that we are currently facing here in the Pacific, and that it was important for like a strengthened multi-sectoral approach to be able to ensure that issues that we face here in the Pacific and also in Australia and New Zealand can be, in a way, like solved. Yeah, and meeting other youth advocates also helped in strengthening my motivation to further strongly advocate for healthier food environments, as well as for a stricter regulation on like junk food marketing. Yeah.
Yeah,
And yeah, sorry
thanks
about
so
that.
much, Lizzie. I was just going to ask you what the kind of particular food issues are in Fiji. If maybe you can tell us a little bit about that and what you were seeking.
So in Fiji, like over the years, aggressive junk food marketing has become quite the issue. It has also reached remote areas where you hardly would have marketing of junk food. And it's quite concerning because young children are highly exposed to this, as well as the adults, the other communities. And because of this, there definitely is a link there between the high rise in the non-communicable diseases rates here in Fiji. Because food plays quite the important role here in Fiji. We do love our food, that's one thing. And and because of that, it plays quite a role as to why there's high amount of the NCDs related diseases here in Fiji. So that's why I highly advocate for healthier food environments and also the strict regulations against the junk food marketing here in Fiji.
Yeah, thank you so much. Kate, I might come to you next. Yeah, CLAN focuses on quality of life for children and families. How is your experience of the HLM on NCDs, and how do you think we can use this moment of the consensus in the political declaration to move things forward?
Thanks very much, Veronica, and thanks for the chance to participate. It was great to be in New York on the lands of the Lenape people, and I'll just acknowledge I'm dialing in from the lands of the Wallumattagal people of the Eora Nation here in Sydney. And yeah, I like Anushka, this was my my fourth high-level meeting. And CLAN first became involved in the NCD discourse back in 2010 when we heard that there was a draft declaration for a UN high-level meeting on NCDs in 2011. And I took a look at the draft and there wasn't a single mention of children or young people or the need for a life course approach to the prevention or management of NCDs. And CLAN reached out to the NCD Alliance, which was bringing together the four big civil society groups of UICC and Diabetes Federation and so forth, and really called this out. And we were really thrilled to be invited to start up a child focused working group of the NCD Alliance back in 2010. And a whole host of people came together from all around the world. And we continued that movement actually as NCD Child in the years that followed. And the American Academy of Pediatrics and then Sick Kids Hospital took that over. So for me personally to take a look at the declaration now, and I might just share my screen if that's okay, because I'm pretty passionate about
Please do.
But yeah, this is, can you see the declaration there okay?
Yes.
I'm quite a visual person, and I just went through and highlighted all of the language now that mentions children and young people and a life course approach to NCDs. And we've just come so far. So, you know, there's a lot of language there. So this was a real celebration, and sitting there as member states spoke to their priorities and to their work in the field of NCDs. So many spoke of children and young people in a life course approach. WHO, UNICEF are speaking about these topics. So we've just come an incredibly long way in a relatively short period of time, which is really great. And I think now the declaration really offers holistic, practical tips. So when CLAN speaks to communities of families of children who are living with NCDs, so it could be cancer or type 1 diabetes or epilepsy or nephrotic syndrome or congenital adrenal hyperplasia, it really doesn't matter what the chronic condition is. Life is really hard in a low-income setting. And so the declaration really addresses the 5 things families say that they want. They want affordable access to medicines and equipment. Well, we've got language around that in the declaration. They want education, research and advocacy. They want the best medical care they can get. They want strong support groups, and they want freedom from poverty. So the declaration has just so much depth in it, really. There's strong references to universal health coverage and primary health care and the rights of people living with NCDs and the importance of people living with lived experience, important of a life course approach. So I just feel that this is a really great platform for us to move on from. And I just want to echo what Hayley said. You know, we can see our friends, our families, our neighbours, ourselves in this, and also our children in this declaration. And that's really exciting. So thanks, Veronica.
Yeah, thank you, Kate. I think really get a sense of the progress that's been made, and it's wonderful to see the expansion of the discussion beyond NCDs being a disease of older generations, I guess, and thinking about it more from a life course approach. Malik, I want to come to you now. We've heard a little bit about the inclusion of lived experience in this process this time around. What are your reflections about that, and how much lived experience has been included in the high-level meeting? And what did you see on the ground when you were there? I'm sorry, you're on mute, Malik. We can't hear you.
Sorry. Thank you, Veronica. I was able to participate in the 2018 high-level meeting as well through the NCD Alliance. And then later at the UHC high-level meeting through the government the following year. And this time around, I was there representing NCD Alliance and the Maldives Alliance and the Southeast Asia Regional Alliance Global General Body. So what I would say is that I would agree with Prof. Anushka to what she said when she spoke earlier, that this time around, what I noticed is during the recent high-level meeting, there was more presence of people living with NCDs and mental health conditions in comparison. So that's a positive point that I would like to highlight. But in the in-person high-level multi-stakeholder hearing back in July 2025 in New York, people with lived experience were also able to be present there, and they were given the opportunity to share their views. So this was before the actual political declaration was finalized, or the draft was come to approval stages. So in that sense, we were able to give our views even back then in this opportunity. And there were like series of multiple virtual meetings conducted by the Global Coordination Mechanism by WHO, and there were 3 separate symposiums specifically for meaningful engagement in the lead up to the HLM, where we got the opportunities for our lived experience to be shared and our voice heard. And in fact, I got the opportunity to present in the 3rd symposium as one of the presenters with lived experience. So, I mean, compared to 2018, I would say there was more opportunity and more inclusion. And one other highlight is inclusion of mental health, and mention of mental health specifically had given a very good focus on mental health broadly, because a lot of times when people talk about NCDs, it's not even in their mind, or it's maybe in the back of their mind, because the common NCDs like cancers, diabetes, hypertension, heart disease come to mind. And then since the wording was specifically there in the title as well, the advocate groups for mental health had the opportunity to have side meetings specifically even during the high level, and there was a very very high level, very VIP level side meetings, even specifically related to mental health. But having said that, some of the missing elements that I would like to mention is that people with physical disabilities. I mean, I would have wanted to see more people with physical disabilities, because, I mean, if they were there present in New York, I mean, we would have seen more people around. But then other people with lived experience, we wouldn't even know whether like they were people with lived experience, because they are like hidden disabilities. And another point that I would like to add to this is, because I'm coming from Maldives, the presence of small island states in the lobbying was a little bit less than I would have wanted. CARICOM presence was very strong. Pacific Island were there, but the Indian Ocean Islands were like almost missing. But then since I was present on ground, I got invited to some of the SIDS meetings, but then it was not because I was like representing SIDS per se, if you know what I mean. So there should have been a lot more of the island communities, especially because of the high prevalence of NCDs in all of these island communities, and the link to climate change in the island community. So that's one thing which could have become better. And also another thing is, when the governments start their drafting and giving their inputs to the revisions or the zero draft, in this process, how much the government consults with the lived experience experts is somewhat different in different countries. For me, the experience in Maldives was a bit better this time, because we did lobby and we pushed a lot and we were invited to sit at the table. But then this does not happen in many places. So this would have been better if more chances were given to people with lived experience during the drafting process also. I'll just stop there and let you go ahead, like, for now. Yeah.
Yeah, thank you, Malik. I think they're fantastic reflections and so important to maintain that civil society engagement throughout the process. I think you mentioned the multi-stakeholder briefings earlier in the year, and you know, the work that's done in drafting these documents before you actually get to the meeting. So, you know, having those opportunities throughout the process really important. Vicky, I might come to you now. You had a role in this, and I know you did participate in some meetings before the actual meeting as well. In terms of breast cancer within the political declaration, can you talk us through how you approached engaging on that, and what lessons you think there are for advocates in that process?
Thanks so much, Veronica. And I suppose I want to preface by saying that it's just such an honour to be on a panel with such extraordinary people who have obviously had experience, and you've heard from the last few speakers about the number of times that they've been to these meetings. For us and for me, it was my first. And I think I wouldn't call what you would say our advocacy to be a traditional model of consultation or engagement, but just so excited to be able to share the reflections. I also wanted to start by acknowledging Hayley from McCabe, who invited myself to be alongside her at the high-level meeting, which was such a privilege and an opportunity to really reflect on this process and this process being new for us. I did want to talk about our consumers, and at BCNA we have a very strong seat at the table program of those with lived experience that are representative. And I know I saw Navina just comment in the chat, she's on the call today, that we've had a number of consumer representatives involved in conversations leading in to the high-level meeting through different mechanisms, whether that be through the UICC. We have a role on the WHO GBCI. We also have a role on the Advanced Breast Cancer Global Alliance, and working very closely with the UICC. I think what became very apparent over the last approximately 2 months ago in early July was the absence of breast cancer. And I think we heard from Kate around the importance of visibility within these documents. And when we think about the gender lens and we think about the inequities and this notion that breast cancer has been solved in the higher income countries, the inequities and disparities continue to exist, hence the WHO GBCI. With a number of advocates within that group, as well as consumers and also other civil society representatives, the conversation started to circle quite strongly about the absence of breast cancer, although there was this notion that, you know, we're not going to call out specific cancers of type, but yet in the drafts, it was clear that there were cancers like cervical and others that had been mentioned. We felt it really important to ensure that the leading cause of global cancer-related death for women and the most common cancer for women was recognised. I think needless to say, leveraging off what some other speakers have mentioned, it was a dilution. We felt that it was mentioned in prevention, but that breast cancer extends well beyond that. But what it does do, and I heard this from a number of member states, was particularly from lower income countries, by mentioning and recognising it, it holds governments to account to really push forward in early detection and prevention. And certainly in Australia, we're falling behind in that space in breast cancer. But I recognise that breast cancer is only one element of cancer. And I certainly felt privileged to be alongside Dorothy Keys, CEO of Cancer Australia, also the work that we did with the Australian mission to the UN and their real interest in wanting to advocate. And they were the ones that put it up in the meeting to have it documented on behalf of our advocacy. So it's certainly, Veronica, been a learning for me, and I'm learning from the likes of Hayley and the George and obviously Karen Canfell. I'm not sure if she's with us today, and Kate. It's certainly a learning for me, and very excited to share my reflections today.
Yeah, thank you, Vicky. And I think, you know, all of you have just highlighted how much collaboration and engagement goes into these big events. So, yeah, I think it's a wonderful result to have breast cancer mentioned within the declaration itself. Karen, I might come to you now. You've had a long involvement in cervical cancer elimination and the regional partnership that's in place to do that, in a very successful partnership as well. Can I ask how that partnership grew and what we can learn from that for successful action for other NCDs and indeed, you know, working collaboratively across conditions as well?
Sure. Thanks so much, Veronica. And just to explain, I'm leaving my camera off because I had surgery yesterday, so I won't subject everybody to the side of me at the moment. But just to say, it's an honour to be here, as others have said. And I'm really excited to talk about cervical cancer elimination, I guess, as an exemplar of what can be achieved in NCDs, although noting that cervical cancer is the NCD pretending it's actually a communicable disease, sort of masquerading as a NCD. So it is an interesting kind of nexus between infectious disease and cancer. So just a bit of background, I lead the Cancer Elimination Collaboration within the Sydney School of Public Health, and I'm also one of the leads of EPIC. EPIC is the Elimination Partnership in the Indo-Pacific for cervical cancer. And this is a partnership that has grown and gained momentum over time. It had catalytic funding from the Minderoo Foundation, and it had it was then established as a DFAT, Regional Health Partnership, and it has grown and gained momentum over time. But I think the key thing to say about EPIC is it is about realising the goals of the WHO strategy for the acceleration of the elimination of cervical cancer, which was launched in 2020 in our region. It is a program essentially involving technical support that's available to all countries in the region. And although there are other donor programs, to our knowledge, this is the program globally that is the most comprehensive and end-to-end, really looking at a whole range of activities from supporting HPV vaccination programs, addressing barriers and hesitancy as needed, to establishing molecular HPV screening programs on the ground with treatment of pre-cancer, to strengthening pathology services, to building registries needed for implementation of screening programs and recall of women, and strengthening oncology services as well. And then also working as countries need it across policy and planning support, and helping to build the investment case for cervical cancer elimination, which, as we know, is a best buy and is repeatedly called out as a best buy in cancer control in all countries, including low and middle income countries. But I think it's very, very important that we support countries to make that case locally for investment into this space. So I think if I reflect, as you've asked, on what some of the, I guess, lessons learnt are, and just to say this was also my first time at the sidelines of UNGA, so I'm a little bit of a newbie in this space, but it's been, I guess, a remarkable and dynamic journey for those of us involved in cervical cancer. Of course, the story goes back some time, and in fact, sort of the roots of all of this are in the evidence and in the research, which then, and the essential insight that HPV causes cervical cancer, which led not only to the vaccine, which is very well documented and very well understood, but perhaps less well understood, it's led to a much better and more accessible way of screening for cancer of the cervix and for pre-cancer, which is HPV testing. And so the elimination framework is all about, it's actually, picking up on Kate's points, is actually about acting across the life course to address the risks of girls and women as needed. So vaccination kind of addresses lifetime risk for young girls, but women already exposed to HPV need screening and treatment, and women who've developed pre-cancer or cancer need access to pre-cancer treatment services and or to oncology services. So I think the first point is that we were always working with a very strong evidence base. And so that has really, I think, enabled those good discussions with countries. I think the second key aspect of all of this is that we have had exemplars of success. So Australia, I do believe, is positioned well as a high income exemplar of success. It was briefly, it was the first country to introduce HPV vaccines. It's rolled out next-gen vaccines. It's been an early adopter of single-dose vaccination, which has been very important from a delivery point of view. And then it was one of the first countries to introduce HPV screening in 2017. And in fact, the first country to move to universal access to self-collection, where a woman takes her own sample, which is, it's an overused word, but it's a total game changer for accessibility. It's a total game changer. Women can take their own sample. It gives choice and control. And so Australia, I think, I mean, we do have some way to go in terms of equity, but there are important initiatives led by community leaders in the First Nations community, in people living with disability, and other culturally and linguistically diverse communities, for example. And Australia has really put all this together with a comprehensive national plan to eliminate cervical cancer by 2035 by effectively delivering these evidence-based interventions across the life course. So it is a good example, but I think as we go forward, our focus, I think, needs to be on developing other exemplars in the LMIC context. And just to mention, for example, through an early program that led to EPIC. Vanuatu has been a leader as a Pacific Island country, working with the implementation support of the Kirby Institute, UNSW. Vanuatu has really hit the ground running on scaling up these interventions and is now really looking to be, has declared that it's planning to be the first LMIC to eliminate cervical cancer in the 2050s. So I think these exemplars are actually key, because when we're talking about, of course, stretched health budgets and competing priorities, we, I guess, need to make the case that this is an important investment in women, but in society and in families. And I guess the final thing I'd like to say in terms of the momentum that's been achieved in cervical cancer elimination, because I get asked this quite often, this is much more than a vertical program. This is, at the very least, a health strengthening exercise across women's cancers. And to some of Vicky's comments, I mean, I think breast and cervical integration is really, really key, and that's going to be a big focus, of our partners over the next few years. Women's cancers need to be addressed, access to scarce oncology services, building capacity in surgery, pathology, and even the basics like palliative care and pain relief. It must be addressed in this space. But beyond that, cervical cancer elimination really, I think, has touch points in primary care, in reproductive health, in screening and building capacity in screening. And so this is not just a vertical. This has potential, really, I think, to have benefits beyond a disease-specific set of outcomes for women and for society. So I think for us making that case and showing how that is actually happening in countries has been key to kind of expanding the efforts, and I think key to the momentum that's been achieved. Thank you very much. I'll stop there.
Yeah, thank you so much, Karen. It's a fantastic story, and I think highlights also the real importance of health system strengthening and investing in all those parts of the health system that we need to really address the experience that people have. I think that's a really good point to turn to some of the questions that have come in on the Q&A. And the first one is around the gap between global commitments and national implementation. So what are the most effective models of collaboration between governments, NGOs and research organisations to sustain progress? Kate, I might go to you first with that one, because I think you talked a little bit about how you've built that through your work with children and young people. Do you have a response to that?
Yeah, I think that community development is key. I think for working with children with chronic health conditions in lower income countries for the last 21 years, when you bring together a room full of people, an auditorium full of people, sort of like, full of people who have the same lived experience, it's very powerful. And people are then, you can work with the community to hear what their priorities are, to work, you can bring in a whole lot of stakeholders to work collaboratively to see how you're going to work with the community to address those challenges. And in that way, the focus becomes the people living with, rather than, one NGO in the spotlight, or one government department, or, one private sector stakeholder being the superstar. All of the collective focus comes back to the people who are living with and the communities. And I would say too that one sector that does this incredibly well in Australia is the Aboriginal community controlled sector. And they do brilliant work. And I would say that Clan has learned a lot from the community controlled sector here in Australia. And it's really a unique model that I think we could, I think the world would have a lot of interest in. So I hope that goes some way to answering the question, Veronica.
Yeah, thank you, Kate. And Malik, I wonder if you've got some reflections on this point as well. You've worked both in the advocacy space through the Maldives Alliance and the broader regional alliance, and also within government. What's your thoughts on how we can strengthen that connection?
Yeah, thank you, Veronica. The first thing I would like to highlight is that before the Maldives NCD Alliance was formed, we were working separately on separate disease-specific CSO NGO work, like cancer separately, diabetes, heart disease separately, thalassemia separately, and so forth. But then back in 2017, we formed the Maldives NCD Alliance through the support of the Global Alliance. And then after that had happened, a lot more possibilities came about, even to work with the government and even with the other sectors and multi-sectoral work as well, because then they started seeing us as a bigger group. Because now we have, we started with 7 NGOs and now we have 11 NGOs in the Alliance who are working in separate disease areas, NCD areas. So that is a starting point. And another thing is we've always tried to work with the government as an auxiliary or as an adjunct to support what the government is unable to do on ground level with the communities in the smaller islands because of reach and very difficult logistics in terms of how Maldives is geographically developed. But then I think this model could still apply in smaller communities, even in landlocked countries as well. But the collaboration with the government to be a partner would facilitate smoother and accountability mechanisms for sure, because then there will not be a hesitancy. And another thing is to prepare for this working together and to also hold accountability. One thing we can do is for us to have our own set of monitoring mechanisms and maybe prepare our own shadow report sort of document where we can then come and speak to the government. So let's do this more and let's work on this a little bit more. So I think just trying to work with the government is the key, and to get more NGOs, more CSOs involved together. Yeah. Thank you, Veronica.
Thank you so much, Malik. I think that's really interesting points you made there, just around just how bringing those different groups together has helped in itself to strengthen that connection. Okay, look, I think we might move now to I wanted to ask a final question, if I may, before I hand over to Lucy to finish up today's webinar. Can I ask all of you on the panel to give a brief 60-second response to the following question? Imagine it is 2030 and we're reflecting on 5 years of action on NCD since this high-level meeting. What are you most proud of that we have achieved? And I'll go first to Karen.
Oh, thanks, Veronica. I wasn't expecting to be first. Well, so look, I'll have to start obviously with cervical cancer because there are 2030 targets as part of the WHO plan to accelerate elimination. So that's the 90, 70, 90 goals, 90% of girls vaccinated, 70% of women HPV screened at least twice in a lifetime, and 90% of women that need treatment being able to access that treatment. And just to say, there's a long way to go on that last goal, with an average rate in LMIC of access to appropriate cancer treatment services of somewhere around 20 to 30%, right? So there's a really long way to go. So I think with 5 years to go to 2030, I would really hope to see significant scale up towards those 90, 70, 90 goals. And we are seeing some amazing, as has been alluded to, some amazing efforts. For example, Indonesia has committed to major scale up over the next few years under the leadership and visionary perspective of Minister Budi. Indonesia will be really looking to achieve those goals in record time, really, in the country that has the third highest burden of disease of cervical cancer in the world, which would be absolutely, which, you know, is expected to be absolutely incredible and also have impact for the rest of the region. But just to mention as well, beyond cervical cancer, I think this integration focus with other women's cancers, so breast cancer, ovarian cancer, and other cancers, which could really benefit from action, from intervention, the GBCI integration with the Cervical Cancer Initiative, that has to be our priority, because we can really use touch points in health services to benefit both programs at once, I think. And so I hope that we have some good exemplars of incredible success in these two cancers where their interventions are possible and action is possible, and we really need to move forward. Thank you.
Thanks so much. Rosalini, can I ask your thoughts? What would you like to see achieved in the next 5 years?
So, what I'd like to see being achieved in the next 5 years is the high participation of youth advocates, people living with lived experiences, not only those that have invisible ones, but also those that are facing physical disabilities, and also like more strengthened collaboration, more successful collaboration stories with each and every countries, not only in the developed countries, but also for the small developing countries. Yeah, thank you.
Thanks so much. Vicky, what are your hopes?
Coming after Karen, I think that was a little bit unfair. Everything that Karen said, I think absolutely agree around, you know, that integration focus, not taking our eye off the ball of the gender lens for women. Obviously, our, you know, priority being breast cancer, but I think that there's also something to be said when we talk about collaboration. When I think about our country here in Australia, the preparation, monitoring, obviously, mechanisms that will be undertaken in the various areas. But I think there's an opportunity to prepare for the next high-level meeting that brings about champions together, lived experience, to really work with government, to have an approach to advocate, you know, thinking about what Australia could do differently next time. And I think there's an opportunity for some reflections around the process, certainly from our learnings and working with the Australian Mission, but also extending what Karen had said around that integration and focus, and using excellent exemplars as that opportunity to learn and reflect and work with governments to enhance this further. Thank you.
Thanks so much. And Kate, very briefly, your hopes?
Thank you. Well, for children and young people, we're in the sad situation where SDG 3.4, sorry, doesn't include children and young people. So over the next 5 years, I'd like to see strong advocacy that sees children and young people included in the post-2030 development agenda. And I totally agree with Rosalini on involvement of youth. And I'd like to see some practical action to reduce childhood NCD mortality that can contribute to SDGs 3.2.1 and 3.2.2. But following up on Vicky's comment there about the Australian government, I also think Australia has a really important role to play in our region and also globally when it comes to children and young people living with and at risk of NCDs. So I'd just really like to see this continue to grow in visibility and focus. Thank you.
Thanks, Kate. And Malik, your reflections on hopes for the future.
Thank you. I would like to see NCDs and mental health, I highlight on mental health as well, to come to limelight, and there's more urgency for control care and treatment for NCDs like it was for communicable diseases before, and a preventive behavior change to start happening by 5 years and then 10 years onward, and for people to be making their own choices and to avoid the lifestyle risk factors and seeking the change that they want, and so that they can make governments and stakeholders to create the enabling environment which is necessary for their lifestyle changes to happen, rather than continued regulations being put in place. I think that would be the actual future, for people to be empowered enough to take control of their health, and then governments and stakeholders ensuring that this can happen for them by creating the needed enabling environment, for example, parks and recreational spaces and things like that. Thank you.
Thank you so much. Well, thank you to all of our panelists for joining us. That's some fantastic reflections that you've shared. I'm going to hand over to Lucy Westerman to finalise this session. Thank you, Lucy.
Thank you, and thank you so much to the panelists and to everyone who's shared their perspectives in the chat as well. There's been some really powerful commentary. I'll just redirect you to the poll, to the survey that we've got going, because I'm actually going to draw from that to just wrap up today. And we're really thrilled that more than 100 people were able to join us on today's webinar to recap the high-level meeting. The people have actually joined us from Australia, New Zealand, Pacific Islands, Indonesia, Philippines, and even I've got a pin on the map from the Caribbean. So we've got a really diverse audience, and it's really fantastic to have such a broad community come together. If you'll bear with me for a couple more minutes, if you have the time. In terms of gathering reflections, a lot of you are coming from the perspective of being interested in really specific chronic diseases like diabetes and cancer and obesity, and also mental health. But you also come from the perspective of wanting to focus on Indigenous health really broadly, or the intersection of law and NCDs, integrating mental health and physical health conditions and musculoskeletal and neurological conditions. So it's fairly broad in terms of where you come from. And I think that diversity that we've heard about in the panel today as well, it brings some complexities and also some challenges. And I know that in terms of negotiating that political declaration, that diversity was part of the challenges. But of course, it also offers big opportunities for us to collaborate, and especially in these areas where our interests are overlapping. So from the survey responses, there's clearly a lot of evidence of enthusiasm to go forward in advocacy, and certainly at the national, regional and global levels. And a lot of interest in building capacity to support civil society to take that forward as well. And as Hayley really aptly said, this isn't a floor. This is a floor, it's not a ceiling, and we've been referring to it as a bit of a springboard for progress. So there's a real appetite to accelerate progress in the Indo-Pacific together. And despite having a lot of evidence about the things that we know that work and so on, there are still persistent barriers like industry interference you're telling us about, financing and resourcing constraints to sort of overcome some of those hurdles. And so, you know, really strong civil society, but a persistent set of silos that are not really being busted adequately yet. So needing to look at that. So we're really looking at that next high-level meeting in 6 years' time and thinking, how can we leverage these milestones along the way, including, for example, the new action plan for the health of Indigenous people that's due up at the World Health Assembly, other regional meetings that are going to be taking place, and the high-level meeting on UHC. So there are opportunities, and you're all saying that you would like to have more of those to collaborate on joint submissions for these sorts of processes, to connect as individuals and organisations, to coordinate and mobilise our efforts together, and to sort of really scale up some of those best practices that we all know are happening but aren't being shared. So how do we sort of more effectively facilitate that? One opportunity to do some of that strategic coordination and collaboration is on the sidelines of the World Cancer Leaders Congress that's taking place in Melbourne next month. We'll be bringing together people for a small side event on the 21st of November. So if you're interested in that, please reach out and we'll let you know. That's in Melbourne. And yeah, finally, I guess, thank you again for being part of the conversation today. Your engagement and commitment is really what makes this community so special. We are still building that momentum up again so that we can make the most of these opportunities as springboards. So please join the mail list that we have, stay connected, and we look forward to working together and collaborating going forward.
Thank you everyone for joining us today. We'll finish up the webinar there, but we will be recording this and we'll circulate it to the people who've registered for the webinar. So thank you again for all your reflections and participation. Bye for now.
Thank you.